important that you continually disinfect your home. Viruses can gather on surfaces such as doorknobs, computer keyboards and mouse, cell phones, tablets, railings, kitchen and bathroom countertops, and remote control devices. To avoid transfer of viruses, wipe down these surfaces regularly with disinfectants such as Clorox, Lysol wipes, or soap and water. Avoid touching your face or your loved one's faces after touching any of these types of surfaces. It is very easy for viruses to be transferred in this way. When preparing food, be sure to use different knives and cutting boards for raw meat and cooked food. Wash your hands before and after handling raw meats. Also, wash your hands before and after using cooked food. Be sure to cook food thoroughly before eating it. This is a message from the Ministry of Health and the National Emergency Management Agency, NEMA.
So you understand what's going on?
Yeah man, it's easy.
Okay, cool. Alright, then it looks like you know what's going on.
Older children may need less supervision, but they need your full support. A few tips for assisting children with online or home-based study. Check in regularly. Ask questions about what they are doing. Don't shout or get frustrated if they don't understand. Encourage them to take breaks from time to time. Be affectionate. Be positive. Sometimes a simple touch goes a long way. As much as possible, provide a comfortable space for children to work in. You may want to be more lenient with the desired study location for teens. Encourage them to focus by minimizing distractions such as television, music, or telephone. As much as possible, encourage them to separate their eating spaces from their study spaces, minimizing the risk of damaging devices.
The Centers for Disease Control and Prevention, CDC, the expert body on coronavirus, has released guidance for general public and healthcare professionals on the symptoms of the virus. A person could be at risk if they have any or all of the following: fever and symptoms of lower respiratory illness such as coughing or difficulty breathing after traveling to areas with positive cases, or having close contact with someone who is ill and is now under investigation for the virus in the past 2 weeks. Fever or symptoms of lower respiratory illness after having close contact in the past 2 weeks with someone who has been confirmed to have the virus. The CDC defines close contact as being within about 6 feet 1.8 meters or within the room or care area of a person with the coronavirus for a prolonged period without appropriate protective clothing, or having direct contact with the infectious secretions of a person with the virus without protective clothing. Coronaviruses are particularly dangerous for people who have weaker immune systems, like young children and older adults. To protect yourself from the virus, try to avoid contact with people who display symptoms similar to those of pneumonia or the common cold, like coughing or a runny nose. Don't touch your eyes, nose, or mouth with unwashed hands. Wash your hands frequently with soap and water and scrub for at least 20 seconds. Use alcohol-based hand sanitizer when possible. Be careful when handling pets. The only current treatment for coronavirus being offered is supportive in nature. If you notice any of these symptoms and conditions, please contact your nearest professional healthcare setup. Help spread this information to everyone.
When you feel a sneeze or a cough coming, try to prevent sneezing or coughing into your hands, as this will contaminate your hands and spread germs. Covering your mouth prevents the spread of germs. You probably knew that, but the way you cover up also matters. And that means breaking a habit you've done all your life. Cover your mouth and nose with flexed elbow or a tissue, not your hands. Discard the used tissue in an appropriate bin immediately. Then, wash your hands with soap and running water to help stop the spread of germs. Turn on water. Wet hands. Apply soap and lather up. Focus on washing your hands for at least 20 seconds. Wash the front of your hands, the back, between fingers and around the nails. Rinse hands under running water. Use something clean to wipe your hands, preferably a disposable paper towel. The best way to wash your hands is using running water and soap, but sometimes we don't have that available. When not available, use hand sanitizer that should have at least 60% alcohol content. Your health is your responsibility. This message was brought to you by the Ministry of Health, St. Kitts.